a proud member of Batchewana First Nation, which is located in Northern Ontario. If anybody knows where the city of Sault Ste. Marie is, Batchewana First Nation is pretty much right there within the city limits. So I also wanted to give acknowledgement to my home community where my family still lives. Next slide, please. We just wanted to go over a little bit of the learning objectives that we'll tackle in this session, and it's leading from for those of you who may have participated and attended the first session, this is a build on from that. So we'll be looking at defining Indigenous health data in Ontario, specifically our jurisdiction, principles and concepts that are relevant to us, Indigenous data types and the usage, looking at privacy and data protection, uh, and, looking at and expanding upon our model of holistic health and well-being and how it pertains to data management, intergenerational transfer of data and information, ethical and cultural considerations, and then data governance and sovereignty. Next slide, please. For those of you who may not know or be aware of the Indigenous Primary Healthcare Council, we're a relatively new provincial-based organization that was established in November 2019. We had our first annual General Assembly in February 2020. And then, of course, we know what happened in March 2020. The world essentially changed forever due to COVID. But the sector itself has been around for almost 50 years, with our longest standing member being Anishinaabe Health, located in downtown Toronto. So what we are is we're the provincial-based organization and council made up of members from across the province of Ontario. And we are located in 21 or 28 different geographies and 21 different members across the province. And you'll see our map here consists of all of the different areas that we service. So we're made up of Indigenous community health centers, Aboriginal health access centers, Indigenous family health teams, Indigenous nurse practitioner-led clinics, and the newer models, the Indigenous interprofessional primary care team. So that's the makeup and the fabric that we focus on in an integrated care model. Next slide, please. So we just wanted to recap what you would have covered in your first webinar that you attended with us. And it looked at the impact of past research practices. And with that, where the whole notion of trust and trust building would have stemmed from, and understanding the importance of working with communities in order to reestablish that trust. The fundamental principle of engagement and collaboration, and what does that mean? And what does meaningful engagement and collaboration mean from an Indigenous perspective, and in particular related to the data collection perspective? And then to look at the impact and application to this practice. So in your current practice that you're focusing on right now, how does this impact all of those past histories moving forward? So next slide, please. So really what we want to do is we want to introduce you to how we as a sector look at Indigenous health data. Next slide, please, Prab. So defining Indigenous health data. So we're going to utilize some very common researchers that you may be familiar with, Dr. Smiley and some other respected individuals within our networks. But really what it is it looks at First Nations, Inuit, Métis. This includes those living in urban, rural, remote settings. And it's us taking a look at the health challenges that stem from a lot of your social, cultural, your historical factors, and how all of those interplay. And how does that impact the health and health status and wellness of our individual populations? Some of the challenges in looking at defining Indigenous health data We certainly are seeing in information that we have and in data that we do have access to higher rates of chronic disease and infectious diseases. Mental health and the health disparities are huge in our populations, and a lot of that linked to social determinants such as poverty, housing, access to education, geography, accessibility, all of those pieces being part of that outcome and how we manage the health status of our individual communities. How do we look at addressing some of these challenges? Um, Cultural appropriateness. I'm sure everybody has always heard of the term culturally appropriate and relevant, but what does that mean? And what does that mean in relation to health data? And how do we use this information to help inform and tailor the policies that we require in Ontario in order to get data that's meaningful and to get data that is truly going to advance population health outcomes for the Indigenous population? So that's what we're hoping to be able to introduce you to in the coming slides for this webinar. The challenges with the Indigenous health data. So to build on that a bit more, a lot of the data that we do have access to right now tends to really focus on negative outcomes. So rather than looking at some of the positive advancements that we've seen in our communities, like decreased smoking rates, cardiovascular death, improved vaccine coverage, we tend to focus on the most negative outcomes. So as a population, even if you look at the impact of the information that you're receiving, if you continue to see those negative outcomes and those negative information portrayed for your communities, there certainly is an additional impact and burden on the community members who that represent. How do we look at monitoring the progress? We certainly have to look at assessing health determinants, our healthcare accessibility, and the impacts of illness and their complications. So looking at things like multiple comorbidities, the social determinants of health, and how do all of those things interplay and give us some of the major health outcomes that we're seeing. And from that, why are we seeing some success factors versus those communities or those individuals who may not be as successful? So taking a look and being able to monitor that progress over time. Deficiencies are also persistent accessibility and the quality of the health data that we do have access to. So many times you will hear in our Canadian and Ontario context that information is not available for Indigenous populations for us to be able to truly assess what is happening within our communities, or the information we do have access to is not as reliable and we're not able to be more confident into the information that is portrayed. So we wanted to give you a little bit of an overview of data gaps within our sector. And so within our Indigenous primary healthcare organizations, we have approximately 78,000 people that we service throughout the province of Ontario. And just to let you know, this is also not without its challenges attached to us in data collection. So for example, in our population alone, even though we have 21 members that are with IPHCC, not all of them have received the appropriate support to onboard into our data systems. So this number is even not an accurate reflection of the whole population that we service across Ontario. So we're continuing to try to build on and improve the accessibility of that data for all of the individuals that we serve. We have 21% of First Nations living off reserve experience unmet needs and healthcare services during the first year of the pandemic. So this is what information was able to be conveyed to us in the actual access to information that we do have. We have 52.2% of children in foster care of the age of 15 are Indigenous of that, despite only 7.7% of the child population in Canada. So that's a massive overrepresentation. So why do we see information and numbers like that? And what are we doing with those numbers once we see them in order to tackle, the most importantly, in order to tackle the social issue and the health determinant that we're looking at? We have 28% of our population incarcerated. So with those admissions to provincial and territorial correctional facilities are very high. And this again is being despite only 4.1% of the general population being Indigenous. So again, a real overrepresentation within that dynamic. Next slide, please. We wanted to introduce you to our model of holistic health and well-being. And how do we look at healthcare and healthcare delivery? So this model here is actually a depiction of how we look at health and wellness for our Indigenous primary healthcare centers. So we look at health from multiple domains, so physical, spiritual, mental, and emotional. And we don't isolate any of those. So many times you'll see in the mainstream systems, there's a physical ailment you're going in for, and that is the only ailment we'll look at when we're going in and having a 15-minute appointment with our primary care provider. A lot of those things that are here within our health center, we don't go ahead and actually apply to how we apply healthcare service delivery in our models. And we also use as foundational to this our traditional healing and wellness approaches. So we view that as actual part of primary healthcare delivery. And then we will complement that with Western models and approaches to care. So there's a lot of things within our model that are contained within our model that don't fit the traditional ways of how we look at primary healthcare delivery and healthcare delivery across the province, or probably across Canada for that matter. Next slide, please. Bridging the gap. So this is actually building off, we call it the, in terms that is meaningful, two-eyed seeing approach. So we take the best of both worlds. What we do through our traditional approaches to wellness and how we look at westernized or contemporary approaches to wellness, we see the benefits in both sides. So how do we take the benefits in both sides of those and be able to apply that to an individual coming in for care and ensure they're given the best possible care delivery they can experience, but also at the same time focusing on things like culture is healing, culture is wellness, culture is treatment. So when you refer back to what you would have heard about in your first webinars for those who attended, you would talk about or hear about the impacts of trauma, the impacts of past relationships with data and past relationships with research. With us utilizing culture as a healing component and a treating component, what we're doing is trying to also address that fundamental value of self-worth and self-healing and that inner spirit. And so a lot of the things, you may have heard of the term social prescribing. Our communities have been doing that. In fact, should probably be teaching about that because how you termed social prescribing is things that we've done through our culture is healing approach model for years and years and years. So just to give you a bit of context of some of the things that are now coming in the fabric of healthcare delivery. Next slide, please. We wanted to introduce you to a video just so it gives you and opens up your mind about how to think about data. So I'll get Prab to share it.
Yapalingana. My name's Maggie Walter. I'm a Palawa woman from Lutruwita, which is an Aboriginal person from Tasmania, Australia. I'm a Professor of Sociology and a Pro Vice Chancellor, Aboriginal Research and Leadership at the University of Tasmania. The Indigenous data sovereignty is about rights, and it's the rights for Indigenous people to control, to collect, to participate. Well, it's the right for us to determine what happens with our data, what data are collected, how it's used, across the whole range of Indigenous data. Data has primarily been used as a way of monitoring us and controlling us. So it's all about, and it's all deficit data, it's all based around how sick we are, how poor we are, how we're not doing as well as non-Indigenous people, and it tends to be very blaming data. So it's used as, you know, the rates of incarceration, etc., the rates of drug usage, the rates of suicide are used to sort of cast us as unable to cope with contemporary Western society, when in fact it's what colonisation has done. We should be scared. We should be very scared because we are increasingly in the spotlight for big corporations and big governments who not only see us as a bankable resource and our data systems and our knowledge systems are able to be exploited, we're also seen as a population that can be experimented on. So new ideas, like in Australia, welfare cards, etc., all of these quite repressive policies are tried first with Aboriginal populations and with Aboriginal children. And that is becoming quite scary. And with the corporations, they're moving in to try and own our data. Back in the 1990s in Tasmania, we had a big thing about identity, and people were saying, you're not Aboriginal, because most of us are very pale-skinned, because this is what genocide looks like. Big American genomics companies came into our little island and were offering people blood tests to prove that they were Aboriginal. But of course, what they were doing was gathering samples, because the Tasmanians, Palawa people, we were seen to be on the bottom of the chain of being as the closest to the apes. So they were really targeting, and I see that, I know a lot of people now, and myself included, that if I have a blood test done, I won't put my identity on those sorts of forms, because we don't know how our data are being gathered, and we're not giving our permission a lot of the times. So the opportunities to use data in a different way for nation building, for our programs, for our own research agendas is really encouraging, and to move away from that aggregate data to be able to have data that's based around our nations, the data that we need. Indigenous data in an ideal world is controlled, has Indigenous data sovereignty, so it is controlled, and the ownership of that data is firmly embedded with the people to whom it relates.
So really what we attempted to do with this video is to let everybody know that Indigenous cultures worldwide are experiencing the same types of fears and challenges linked to data and information and how their information is used. And a lot of that is linked to colonization and the process of decolonizing how we look at some of these processes, and how do we ensure that our data is used for positive purposes. So we just wanted to set the stage for how you, as individuals working within the healthcare sector and taking a look at health information data, these are some of the very real questions that are being posed, not just here in Canada, but worldwide. So how do we define data sovereignty? And how do we look at it? So we had a series of engagement sessions with our membership. So just to give you a bit of context, we are status blind. So what that means as an organization is we service all Indigenous people: First Nations, Métis, Inuit, urban, off reserve, on reserve, all of those Indigenous individuals who self-identify are able to access service through us. And in some cases, we also service their families, which may be non-Indigenous individuals who are married into or linked in through via partnerships to the Indigenous network. So how do we look at it from partnerships? Engagement is critical. And also moving beyond just looking at taking people for word, but actually being able to put your word in writing and do that through agreements so that you actually have a way to evaluate your relationship. So that's why partnerships, we're moving to more the formalized approach so that we actually know what we're committing to when we do commit. We have to look at policies. So how do you actually put policies in place to say implement any of those agreements that you might have? So how do you internally as an organization, or internally as those working in the healthcare sector and field and looking at data, ensure that those safeguards are in there so that there is accountability to that information? So that means your processes must have indicators that are measurable, and things that we can actually say, yes, we've been accountable to this agreement and to the communities that we work with. But most importantly, taking a look at lived experiences. Do the actual people that you enter into agreements with and the Indigenous population actually benefit and support the intended outcomes that we're looking to support? So are we actually having a validation process through those personal experiences saying that, yes, we see a change or we actually are getting value based on the information that you're collecting from us. So this is us taking a look at it from multiple lenses. So traditional approaches as well as Western approaches to data and data management and sovereignty. Next slide, please. Intergenerational transfer of data. So really what we want to show is, even though technically how we look at research and how we look at data and data transfer and how we look at analyzing our information, there's a very structured way and a westernized process of how we look at that. But Indigenous communities have also had their processes for years and years and years. And we also have to look at validating those processes for the individuals that it is meaningful to. Next slide, please. And what does that mean? Storytelling is critical for us, and it's how we passed information intergenerationally between, despite even all of the trauma that we've seen a revitalization of those individuals who kept very sacred pieces of knowledge to pass forward and pass down into various generations, and to make sure that we have these cultural elements that make up who we are as a population continue. And even how do we look at our traditional approaches to healthcare delivery, and how do we communicate with each other between generations? And it's critical. The First Nations, the Inuit, and Métis all have those aspects of how they transfer data between generations. Next slide, please. Ethical and cultural considerations for your present day. I wanted to give you just some looking at ethical research practices and how do we empower the research process within our communities. Engagement is critical. So we do a lot of things through community-based participatory research. And the other piece that we've also started to educate anybody doing research and data is to make sure that the community you are working with, or the communities you are working with, also have access to resources to participate, that it cannot be a one-sided participation. So that needs to be equal in being able to come to that partnership. There needs to be gains on both sides. Of course, I'm sure if you've taken intro training to cultural safety, you'd probably be most familiar with OCAP principles, which is ownership, control, access, possession. That's a very First Nations driven process for how we look at data. But we also have an Inuit process that is referred to as IQ, as well as a Métis process that is referred to as OCAS, which is ownership, control, access, stewardship. So they have their own ways of looking at data and data information, and how, again, that information is passed between their communities. It's very important to collaborate with Indigenous researchers and organizations to make sure you are factoring in community priorities and values. Take the lead from the communities you're working with, being able to understand what is valuable and meaningful to them, and how do you actually reflect that in the work that you're doing, and what information do they want to know about. And again, not because you're curious to know about it as a researcher, as somebody who is in science or doing data, but the community actually has value add of being having access to that information. Ensure that you recognize and incorporate Indigenous knowledge systems and methodologies. And what do we mean by that? Um, you might look at a focus group. We look at things like storytelling circles, sharing circles, sacredness of ceremony, and us sitting down together and participating in a ceremony to actually lay the fabric of how the relationship is going to look like. Those are particular things that communities do in order to honor that relationship that you're going to enter into. Next slide. Ensure there's informed consent. Actually have the community have an understanding of what it is that they're committing to, and keep the communities informed. Sharing information and understanding, not just coming in at one time and then the community doesn't ever see you again, or only sees you then when the information is being presented. Actually have the community engaged throughout the process to understand how you're using that information and how they're benefiting from the information they agreed to participate in. Build capacity with your communities. And some examples, IPHCC themselves have actually been hiring students through Indigenous programs to actually work with us in our program areas so that we can actually train them how to use our own data and how to do and actual design programs from the data that we do have access to. So we've entered into various partnerships with academic institutions in order for that to be materialized and fostered, to make sure that we're also capturing an interest in our younger generations. Practicing cultural humility for cultural protocols. So, for example, how do you approach traditional people and elders? How do you engage with leadership and the communities? What are respectful ways to do that? Make sure that you actually respect the way the community does business, not the way you are expecting anybody else does business. And then, of course, sharing your research outcomes and benefits. Validate your understanding of the research. Maybe your understanding might not fully make sense to the community, and there's other variables and dynamics that you need to understand in order for that bigger picture validation of that information for it to make sense. Next slide, please. Data types and usages. Um, so this was a very important quote that we thought that is important to acknowledge. Indigenous people are often categorized into the other category and thus not represented in the data. This junk data category tells us nothing. Why is it still included in standard data collection nationwide? So this is just a comment to say this type of data doesn't say anything to us and isn't meaningful to us. Next slide, please. So how do we use data? So again, this is very sector driven and is based on the input from all of our members from across the province. But we look at it to improve our population health outcomes, research, advocacy, how we evaluate and do quality improvement and quality assurance across our system. We also use it for administrative data, so taking a look at the evidence that we have and us also being able to benchmark our performance along the way. So similar things that we do in mainstream, these are things we also want to be accountable to our own communities, but we have our own ways of doing that. And the other thing is storytelling. And what we're about to show you here is a way of our sector and how we look at data governance, and we label it as stories of strength. And what does storytelling and the significance of that mean to us? Next slide, please. So here's some very common national administrative databases. I'm sure that you're familiar with the census data, the national household survey databases. One of the things that we really want to say is a lot of times these things are inaccurate and misrepresent us due to some of the categories that we talked about, but also due to the actual complete denial of individuals wanting to actually self-identify. So similar to what we heard in the video, because there's a fear of how that information is going to be used. And obviously the fear is right now, it's very much pointing in a way that it's not going to be used to our benefit. And why is that? And I think for us being in the social context and being in the Canadian context of healthcare and healthcare delivery, at the end of the day, we're all hoping, I think, being in healthcare to also want to move towards us taking a look at the most positive health outcomes that we can have. But why in the fabric are many Indigenous people thinking this is not for their benefit? So I think that is something that we have to self-reflect on in the processes and the procedures that we put out as well. So there certainly is recommendations of how we improve this. And again, it's based on those principles that we identified in that previous slide. Engage the communities, have them lead the process, have them have an understanding of how this information is going to be used and used for their benefit. And how do they use this information in order to get the appropriate programs and services they need within their communities. So we still have a lot of work to do in that area. Next slide, please. Our healthcare data. So what is it? Data collected from healthcare providers, institutions, and systems, which can be used to monitor health status, service utilization, and outcomes of the population. So a lot of times in the information that we do have access to, we see limited breakdown of the information by Indigenous identity, And then, of course, there's also ways to classify Indigenous status and lack of a culturally appropriate and relevant health indicators. There's ways we don't find ourselves of how to present ourselves in this data. So really what it does is it causes a lot of people to not want to participate. And I can tell you right now in myself, I never self-identify because I'm not sure where I fit in those data, as one example, and my family does not participate. So again, we have recommendations going forward and how we look at healthcare data and how we also look at creating our own specific indicators. So that process is more meaningful to us, and not only to us, but to the system. Because once we get the population health outcomes and the positive outcomes we're looking for, our whole system will benefit. It's not just us as a population. Next slide, please. We wanted to let people know more and more individual institutions are looking at Indigenous self-identification. And how do people self-identify, and what's the importance of that self-identification process? So we wanted to let you know, as IPHCC, we embarked upon this process actually during the times of COVID. And if you remember, when the Canadian government was first announcing the priority populations for COVID and vaccination, Indigenous population was identified as a priority population. We ran into the issue, how do we have individuals identify in that process, and how do we have individuals be categorized in that priority area? So you will imagine that there was a lot of things that went through this whole fabric of saying, okay, we had individuals, to be honest, their first thought was, oh, you want to categorize Indigenous people in this category because you want to experiment utilizing the vaccine because it's new on us. So those were some of the things that we actually had to combat. Again, those historical pieces that you would have seen in that data process, in that research process. To let everybody know, as IPHCC, we do have a training course that was designed, that we worked in collaboration with hospitals to take a look at. In fact, we had a hospital that agreed to be a test case for us in collaboration with one of our regions to actually go through a self-identification process. So here's a sample of what the tool looks like. We have a toolkit as well as a training program to look at some of the things we've learned through that self-identification process. So we just wanted to identify that as a tool that institutions as well as our communities are starting to implement. Next slide. Data governance and principles. Next slide. There's an understanding with us as a sector. We actually operate according to 3 levels of governance. So we have our members who actually make up IPHCC, so the provincial council. And then we also have overlap that goes into the federal system with information and data that we all collect. So we needed to realize within our system and taking a look at our data governance that we had to look at the macro, the meso, and the micro. So what happens at the micro level with our individual health center communities collecting information on their patients and clients coming in? What do we do with it as a provincial-based organization when we're a steward for all of our 21 members who are across the province? And then from there, how do we have our relationships with government at the provincial and the national level? And how do we ensure the integrity and protection of that data? So in our fabric, or in our framework that we've looked at, we've actually looked and factored into these 3 levels of governance. Next slide, please. What are the principles? So these are the building blocks we have access to, like we said, First Nations data, Métis data, Inuit data, those living in urban settings as well. And how did we look at as representing all 3 of those areas and all those individuals coming in self-selected through healthcare delivery through our network? We established a framework that was called Stories of Strength. So this is what we're actually going to share with you. So this was actually made, this was 2 years in the making of doing some really, really severe and community engagement for us to actually create a data management lifecycle and governance framework for us to ensure that we had appropriate feedback from our sites. So you will actually see we call it Stories of Strength because the Stories of Strength is actually an acronym. So if I say the word SOS, if somebody sends you an SOS, probably typically people would think save our souls. There's some type of emergency. And for us, there is an emergency. There is a national emergency, an international emergency, and how Indigenous data and information is used. So we refer to SOS as safeguarding our stories and making sure that our stories are not used in a way that's not to our advantage. And we need to stop those systems taking place. So again, it's an SOS out to our communities who actually are in these areas to make sure that we do this in an appropriate and effective way. So you'll notice we look at things like safety, trust, ownership of the data, that it's relationship central, that there's impact and that there's awareness of the impact, excellence in for what we do, strength building, making sure that we build the strength of our Indigenous individuals as well as knowledge keepers within our system, that it's optimistic, not always having to focus on the negative outcomes or a deficit-based outcome. Framing it in opportunities where we're actually learning together and we're going to pursue towards advancement. And how do we promote health outcomes? Supportiveness, that there's support on both sides through this process, that it's truthful so that we're able to have those difficult conversations when we need to, that it's respectful and we respect both parties or all parties coming to the table. Expression holding, that our individuals feel like they are able to express their truths within this information that we're collecting, within this information that we're sharing. Narrator focused. It means that we're narrators of our own stories. We do not need to be having outsiders telling our stories for us. We need to be gifted with that to be able to tell our own stories and to make sure those stories are meaningful to us. So gift giving and gift valuing, we all have a gift to bring, and we need to be able to be the individuals to do that for our communities. That it's traditionally based, that we also look at our traditional ways and ways that we've actually carried and maintain knowledge throughout the system, and how do we ensure that that process is protected going forward, and that we honor the actual sovereignty of all of our individuals, all of our communities that are here and participating in this, and that we know our rightful place of when and when not to participate, or for that community to take leadership in what it is, the information that they have access to. Next slide, please. So we wanted to look at data strength and privacy. The IPHCC ran into a lot of challenges with our current legislation tied to privacy and confidentiality, especially during times of COVID. And so what we did is we actually hired some specialists who worked in privacy to help us develop an Indigenous privacy framework. And this is something that we're actually right now piloting in some of our sites so that we get a sense of what this privacy framework looks like, and then to be able to design a toolkit and a training from that to help educate system and system users, as well as our community people, on how to approach privacy and how to approach it with a lens of, when you have access to information, how do you assess that? How do you look at doing a privacy impact assessment? How are things like the circle of care taken a look at? Those kinds of things. So some really key elements in there. So really what we wanted to do is to alert everybody here that this is actually something that is in process right now. And this was built off the CSA model for standards, just so you know. So what you're looking at is the code, and then we added the Indigenous privacy framework supplement to that code, just because it's something that people are most familiar with. So really in the recommendations for this, we certainly recommend that the development of privacy policies and legislation include Indigenous communities and populations. We also are really strongly saying don't allow legislation to promote structural racism, because some of the things that actually happened and came out were actually tied to how the legislation was structured. And it wasn't to the best interest of our communities. So those are some of the things that we've actually had to argue in that, and to ensure that how we look at legislation, it needs to be looked at from an inclusive lens. Next slide, please. So here's our data sharing and protection. So really what's important for us, we embarked upon developing data sharing agreements. So when we talked about that micro, meso, macro, as a sector, we looked at how our relationships with our individual communities and individual members coming in for care, how their relationship looks like, how their relationship with us as IPHCC is factored in, and how does that data sharing agreement go? How does a data sharing agreement go with us between the other sector of the Alliance for Healthier Communities, where they are working with community health center data, of which our data is part of that repository? What does that relationship look like? And then from there, what does the IPHCC, the full council's relationship look like with government? And that's federal and provincial or other institutions that we may work with. So we actually have 5 levels of DSAs that we designed based on our experiences and our relationships to this point. So again, being able to protect our data and utilize it in a way that's to our benefit, and safeguarding that through an actual agreement on where we know the accountabilities of all parties lie. Next slide, please. Conclusions. Definitely empowering Indigenous communities through data governance and sovereignty and protection is critical. And most critical for addressing unique health challenges. Many times we do not see where we fit in the fabric because data for us is not collected. Or if data is collected for us, as we mentioned, it's very deficit based, and we're not able to have the ability to utilize that data for our own benchmarking, our own indicators, and what is happening in our own communities. And does that make sense? So we certainly need to make sure that there's a culturally appropriate process, that the data is relevant for us, that we have intergenerational transfer of knowledge, that the process is culturally safe. And that includes the full collection method, the methods, the privacy, the data protection, all of those data management cycle, and ensuring that it's inclusive. We needed to, as a sector for IPHCC, recognize that we hold pockets of data that are community First Nations, Métis, Inuit owned, as well as the protection of individuals who self-select to go in for healthcare delivery, and make sure all of that is safeguarded in a way that we are seen as a steward and doing that in a good way, and not utilizing that information for any purposes other than what it was intended to be used for. So we certainly have to work together as a system. We are well aware that we cannot do this alone. We continue to argue with ensuring that resources are put into our communities to ensure that accessibility is across the board. Consider opportunities to collaborate and collect, and ensure that communities lead the process instead of just be a follower in the process. And we undertake reviews ourselves as a sector to standardize our own data, and also be able to take a look at it through a nation-based perspective. So when we talked about that ability to break down our data, those are things that we're starting to move into, because that's more meaningful for the communities that we represent.